Pain Assessment and Interventions. Welcome to the LPN Launchpad. In this session, we are focusing on the critical skill of pain assessment. As a nurse, you are the detective responsible for uncovering the nature of a patient's discomfort. By using standardized tools and systematic methods, you ensure that pain, the fifth vital sign, is never ignored. Subjective versus objective data. Always remember that pain is subjective. The patient's self-report is your gold standard. We must also remain sensitive to sociocultural differences in how pain is expressed. While we look for objective data, like tachycardia, elevated blood pressure, or restlessness, the absence of these signs does not mean the patient is pain-free. If they say it hurts, it hurts. The ABCDE Approach. The ABCDE method is a systematic approach to pain management. It reminds us to ask about pain regularly, believe the patient's report, choose appropriate control options, deliver interventions in a timely manner, and empower the patient and their family to be active participants in their treatment. Numeric and visual scales. Selecting the right scale is half the battle. The numeric rating scale, from 0 to 10, is the standard for most adults. For those who struggle with numbers, the visual analog scale uses a simple 10-centimeter line on which the patient marks their pain level. Alternatively, the verbal descriptive scale allows patients to use words like mild, moderate, or severe to communicate their needs. Assessment mnemonics. For a comprehensive look at a patient's pain, we often use mnemonics like OPQRST or OLDCARTS. These tools help us identify the exact onset, quality, and region of the pain, as well as any previous treatments the patient has tried. Using these systematic approaches during a comprehensive intake ensures that no triggers are missed. The HILDA Method, another effective assessment tool. H stands for, how does the pain feel? Is it aching or sharp? I is for intensity, using a formal rating scale. L is for location, D is for duration, is it constant or intermittent, and A stands for aggravating or alleviating factors, what makes it better or worse. Specialized scales. For specific populations, we use specialized tools. The Wong-Baker faces. Scale uses expressions ranging from smiling to crying and is ideal for pediatrics or patients with cognitive impairments. For infants or nonverbal patients, we use the FLACC scale, which assigns a score based on observed behaviors: face, legs, activity, cry, and consolability. NCLEX Practice. Question 1. Let's practice. An 80-year-old patient with moderate dementia is restless and grimacing after a fall. Which pain scale is most appropriate for the nurse to use? 1. Numeric rating scale. 2. Visual analog scale. 3. FLACC scale. 4. Verbal descriptive scale. Answer and rationale. The correct answer is 3. FLACC scale. This is the best choice because the FLACC scale is based entirely on the nurse's observation of behavior. Since the patient has dementia and may struggle to communicate their needs through abstract numeric or visual scales, an observation tool is the most reliable way to obtain objective data. NCLEX practice. Question 2. Next question. The nurse is performing a pain assessment using the OLDCARTS mnemonic. The patient states, "The pain gets much worse when I try to walk to the bathroom." Which component of the mnemonic does this address? 1. Characteristics. 2. Aggravating factors. 3. Onset. 4. Relieving factors. Answer and rationale. The correct answer is 2. Aggravating factors. Walking to the bathroom is a specific trigger that intensifies the patient's pain. Identifying aggravating factors helps the nurse distinguish what makes the pain worse versus what makes it better, allowing for better planning of activity modifications or premedication. NCLEX practice. Question 3. Final question. A nurse is caring for a patient reporting severe pain. Which non-pharmacological nursing intervention should the nurse perform first to promote comfort? 1. Wait 30 minutes for the morning medication to work. 2. Reposition the patient and smooth wrinkled bed linens. 3. Teach the patient how to use the call light. 4. Ask the family to leave so the patient can rest. Answer and rationale. The correct answer is 2. Reposition the patient and smooth wrinkled bed linens. These are fundamental nursing comfort measures. By addressing immediate environmental irritants and improving physical alignment, the nurse can provide instant, basic comfort that supports the overall pain management plan.